What is a Barbie nose? A Barbie nose is a popular type of rhinoplasty that has gained attention in recent years. There are patients who seek information about how it is performed or the technique used to achieve it. Some patients come and say, I want a Barbie nose. So, do I support the Barbie nose procedure? No. Do I find it aesthetically pleasing? No. These are noses with a completely hollowed out bridge and a tip that is lifted as much as possible, giving the appearance of a button being placed on the nose. Is there a group of patients who want this? Yes, but I am far from this trend and do not find it appropriate. We can reduce the size of a nose. We already provide various suggestions for nose reduction. Because, as I always say, we reduce some noses while we enlarge others. For example, when it comes to enlargement, patients often feel very anxious. They ask, are you going to make my nose bigger? For instance, look at a flat nose. In our population, these are typically noses that require reduction. But if today, a black patient or a Central Asian or Far Eastern patient comes in, their noses tend to be flat. You have to augment them. Or if it's a collapsed nose, a previously operated nose, or a revision nose, a nose that has had too much tissue removed from the bridge, might require internal cartilage support. This can help the nose adopt a more defined and structured shape, which enhances its aesthetic appearance. So when we talk about an augmented nose, it shouldn't be misunderstood. Reducing a nose is also very common, especially in our country. For instance, some people have very prominent, large noses, what we might call massive noses. In these cases, you can't just lightly file it down and call it a natural look. There are situations where you need to take a more radical approach. You also need to maintain balance while doing all this. It takes effort and diligence to shape the nose in the way the patient desires. Sometimes, minor adjustments can lead to dissatisfaction and inadequate results for the patient. If you do too much, on the other hand, you end up with an exaggerated result. This disrupts the overall balance. For example, sometimes a patient comes to me and they've had the bridge reduced, but the tip looks disproportionately long. It creates an unappealing appearance. When you suggest working on the tip, you might encounter another problem. In such cases, perhaps filling those areas makes more sense. By filling the hollowed-out bridge or the front area, the appearance instantly becomes more beautiful and attractive. So sometimes augmentation can indeed be the right choice. This is actually the purpose of filler applications, to fill in and augment. So sometimes increasing the size of the nose can also be necessary.